purpose of today's meeting is basically to highlight especially babies and children who are less than 5 kilos weight, up to almost adolescent age. A very rare birth defect called transposition of great arteries. My colleagues here will discuss more in detail as well as explain what is exactly this defect, how it shows up, and what lengthy operation, lot of post-operative difficult courses. Very few centers in India, cardiac units, take up such high-risk operations. The risk of losing the child in the theatre as well as immediately in the post-operative period is very high with this particular defect, which is why most centers play it safe and they don't touch the children. At Lotus, the team of surgeons as well as cardiologists and intensive care specialists have created a facility where we are capable of dealing with the very most complex operations, especially something as complicated as the arterial switch operation which is done for this particular cardiac defect. I would like to introduce my colleagues here and our team members. Dr. Kavita is a pediatric cardiologist. She is a children's heart specialist who has joined us more than a year ago. She has come back from the United States of America after practicing there for many years, and she is highly experienced and highly trained in this specialized field. Dr. Ganapathy Subramaniam was a children's heart surgeon. He also trained at All India Institute of Medical Sciences, and he was in Australia for 2-3 years for training, and then he was working in Chennai in a leading hospital, and he has joined us a few months ago. Dr. D.V. Nagaru has been with us right from the beginning, a senior pediatric cardiac surgeon. He has been operating on all kinds of defects so far. The post-operative care is equally important as much as the operation itself. My colleague Dr. Anjul Dayal is an intensive care specialist for children who looks after very sick children and also children recovering after heart operations. And Dr. N. Sridhar is also a consultant. With this, we will be highlighting about this particular defect as well as we will hear directly from the parents of the children who have undergone this operation as well as their own feelings about this particular defect and the type of operation. More importantly, our center is the only center in the private sector which has a children's heart unit which can deal with such operations and also do medical therapy in the entire country. In the private sector, exclusive children's hospital having its own cardiology department with a cath lab and all other facilities and operating on such complicated ones, ours is the only center. With this, I will pass on the mic to my colleague Dr. Kavita Chintala, who will start the initial proceedings about the defect and various complications.